Thank you, Madam Chair. Dr. Bhattacharya, first of all, I enjoyed our conversation last week. I do think there is a real value in looking at smaller institutions as well and providing an opportunity for them to participate and compete for the grant dollars coming out of NIH. And I think you may very well find that their overhead may be substantially less. I also think, just in terms of being fair, I think we've got to do perhaps a clearer job of understanding as to what would be considered direct or indirect costs and lay that out with regard to whether or not it's overhead or something that's needed. If a smaller institution has the need for a centralized, larger computer system, and that's a larger part of what's considered overhead, it may very well mean that that's a larger part of what they're going to be spending their money on, but it might be a very important part of an experiment. Is that a fair way of looking at it?
Absolutely, Senator.
Okay. Look, I think what you're hearing today is in a number of areas, first of all, that by tradition, a president would suggest a budget and then a Congress would modify it back and forth. What I think we're assuming is that in this particular case, the president's budget has said this is the very basic minimum. Congress, if you're going to authorize stuff, you're also going to be accountable for actually appropriating the money. And so the expectation is, even more than a negotiation, is that we will be expected to put the money where we think it is best. And when we do that with an appropriate authorization, you will follow the law and you will see that the money is spent in those appropriate locations. But it will be up to us, once again, to reassume the responsibility we've got for actually deciding and telling the American people we want to spend the dollar in the following areas. Is that what you're sharing with this committee today?
Absolutely. It is a negotiation, a cooperation between Congress and the administration for deciding where the research needs of how to best meet the research needs of the country.
I'm convinced that there's an opportunity to do two things at the same time, and sometimes I think it's misunderstood in terms of how we approach spending money, and that is just as an example, in Medicare, 2/3 of all the people that are on Medicare have 2 or more chronic illnesses. We spend 93% of the money in Medicare on those 2/3 of the individuals. They're suffering. Their quality of life is not good with 2 or more chronic illnesses. If we can find a way to improve their quality of life and actually save tax dollars by addressing those chronic illnesses, whether it be diabetes, whether it be Alzheimer's, whether it be Parkinson's, or cancer, it's kind of a win-win situation, isn't it?
Absolutely, Senator.
I don't think we can do that without integrating AI into this process. And I think we're on the verge of actually doing a lot of that today. But part of it requires databases. Let me work my way through this just a little bit. I think we have to invest in modernized data systems, including leveraging AI to accelerate research, maintain global leadership in life sciences, and develop treatments and cures for both chronic and rare diseases. As a co-chair of the Senate AI caucus, I'm one of the individuals who have championed several pieces of bipartisan legislation. This is bipartisan in nature, to expand AI literacy, adoption, and competitiveness. Now, I've been briefed on the National Center for Advancing Translational Sciences, known as NCATS, and their work on N3C. I'm impressed by its success and its role in supporting the National AI Research, or NAIR pilot. However, under the budget, I noticed that NCATS will be folded into the National Institute of General Medical Sciences. How will NIH's proposed consolidation strengthen NCATS leadership in data science, AI, and machine learning?
So I also am tremendously proud of NCATS and what it's accomplished in AI. I'm also aware of the program you're talking about, where my predecessor, Director Bertinelli, she developed this program. I fully support using NCATS to address the needs you're talking about. To me, the most important thing isn't the exact organization of but rather the actual activities that we do. And under whatever reorganization we do, of course, Congress will have its say. I want to make sure that those activities go forward, because I agree with you, Senator. The investments that we make in AI will pay off dividends enormously. It's a tremendously promising way to do scientific discovery and also to make patient care experiences and physician-doctor relationships much better, and better diagnoses, better ways to manage patients and to prevent illness. I think AI is going to play a real important role in all of that.
I think the next step will be literally incorporating AI as an agentizer in the development of multiple types of approaches to solving lots of these chronic illnesses. And I am very hopeful. This is not something that's going to take decades. It may take years, but this is an opportunity to really show an improvement in quality of life that impacts American families, not just the individuals that have those chronic illnesses, but those who take care of them as well. I look forward to working with you, sir.
Likewise, Senator.
Thank you. Thank you, Madam Chair.